She found something. Good afternoon, ladies. Thank you so much for joining us. That's really loud. That's okay, lots of echo. I wanted to introduce our speakers today, which is Kristen McPeters and Brandy, I don't know your last name, Garris. And Brandy is the head nurse in the NICU Center, and I'm going to give the microphone over to you guys. So hope you all enjoy it. It's such a wonderful thing, this PALS, and I'm so excited to hear about it. Thank you for joining us.
Thank you, Courtney. And thank you all for having us. We're honored to be here with you today. And so grateful for the grant that we have received from the National Philoptochos Society and for your part in making that happen. And since it was here, right in Wilmington, in your community, we wanted you to know what your generosity was helping to make possible for the babies that we serve. So since we're here, I'm gonna start with a little bit of an overview of who we are as the Hospital Foundation and some of the things that Novant is doing in the community right now, and then we'll talk about the grant that you gave. But I think I know people in our community have a lot of questions about what's going on, and so I wanted to give you some general updates while we're here. So go ahead, Brandy. So I'm Kristen McPeters, and as I shared, I'm a philanthropy manager with the Novant Health Foundation here in Wilmington. And if you're familiar with Novant at all beyond Wilmington, Novant has grown by acquiring hospitals. And as it's acquired those hospitals, it's also acquired the foundations that support those hospitals. And so there are two here in our region, the New Hanover Regional Medical Center Foundation and the Brunswick Medical Center Foundation. And people also get confused. We are different than the endowment, which was created when the hospital was sold. We are still the same hospital foundation that has supported NHRMC for 40 years, helped to build the Zimmer Cancer Center and the Betty H. Cameron Women's and Children's Hospital, and has done lots of things in our community for a long time. So go ahead. There are 5 of us that support both of those foundations here in our region, which Novant considers the coastal region for North Carolina. And so wanted to just show you some of my colleagues in case you might know or recognize a few of them. Most of us have been around Wilmington for a while, but we are here raising money from the community to support the hospital. There's another whole team of people. When you see Novant sponsoring things in the community, showing up at a health day or helping to sponsor the Azalea Festival, that's kind of another whole group of people. What we are doing at the foundation is raising money from folks in the community, families, businesses, family foundations, who want to impact the health of the community and want to support the work that's happening in our hospital. So go ahead, Brandy. And what that looks like is a number of different things. So this is a little small. I'm happy to share the slides with you later. But one of the things that we raise money for is institute support. So we consider our institutes the kind of areas of healthcare at the hospital. So the Neuroscience Institute, the Heart and Vascular Institute, the oncology, those are all the kind of the different institutes of the hospital. And so you may have seen recently that our Neuroscience Institute was named after Michael Jordan's mother, the Dolores P. Jordan Neuroscience Institute. And that's a really big example of funds coming in to support an institute at the hospital. And they're still working on what that will do, but I expect it to open up whole new lines of care in neurosciences for our region, which is very exciting. Pipeline recruitment and staff education and support. So that's really support that we provide for team members at the hospital. So we know that we are the largest employer in the region, and there's a lot of people who are depending on the hospital for the health of themselves and their families. And so there's a lot of work that we do to support our team members to make sure that they can advance in their own careers, can be healthy. There's emergency funds, scholarship funds, well-being funds, ways that we're making sure that they are the healthiest they can be so that they can take care of folks in our community. And then health equity and patient education. So you can see on the screen, the top right is one of our Michael Jordan clinics that opened here in Wilmington. The bottom is the community care cruiser. There's 2 of those, and there's also a mammography bus here in Wilmington. Those are all things where the foundation raised the money to bring that resource to the community, and then the Novant Health sustains that resource. So Novant covers team members, the employees that work in those places, but the foundation provided the clinic and the mammography bus. So go ahead, Brandy. And a couple other ways, health access is something that we do a lot of and that is really important to health of our community. So we talked about the Care Cruiser provides screenings and education. We have a mobile mammography unit that travels around and provides mammograms, along with some funds that support making sure that diagnostic services are available for breast health. You may have been familiar with the Pink Ribbon Luncheon that happened in the past. The luncheon isn't happening anymore for the hospital, at least, but that fund is still there. People are still giving, and it's still providing the same diagnostic services for women that are so important. Some other examples, we have some medication assistance funds, emergency food boxes that are provided for patients, some resource funds that provide transportation, lodging, wigs. For oncology patients, we have similar resource funds for children and families that are part of our children's hospital. So there's a lot of different things that we raise money for, but really all focused on the health of our community, accessing health care, accessing the resources that they need, and making sure that as much service is available so that people can receive excellent health care here and not have to travel somewhere else to receive that care. So these are a couple big examples of things that the foundation funded last year. A pediatric MRI monitor was an important one. We do everything that we can to help kids not have to be sedated when they're having an MRI, but some do. And we had an adult MRI monitor that we were using for our anesthesiologists in our MRI units in the hospital, which was just not as safe for kids as it really should have been. And so the foundation helped us to purchase a pediatric MRI monitor that would be a lot more sensitive and safer for kids. 2 investments in the emergency department recently, and these are in progress. So if you've been in the emergency room recently, you wouldn't have seen them yet. But electronic whiteboards and electronic stretchers for the emergency department, which will help with communication and making sure that patients receive up-to-date communication from their beds about whatever weight they might have, who their caregiver is, what the progress of their care is. And similarly, it provides really up-to-date, immediate information for our care team so that they know if someone has a fall risk or needs to be on isolation. Those things are translating directly from the patient's chart to that electronic whiteboard instantaneously, which we are really excited about, providing that fast, reliable communication for team members and patients. Another one that relates to babies and care, and your focus here this morning, are some new triage beds for the Brunswick Medical Center. We are privileged to have a lot of care across our region, and we know that all of it ties together. So if we can serve more babies or have more babies born at the Brunswick Medical Center, then it keeps our hospital here in Wilmington from seeing quite as many women and babies. We will still receive the ones that need to be at a larger hospital, but if as many of the Brunswick babies can be born in Brunswick as possible, that helps everything not to be as crowded and to spread out the birth of those babies. So we'll have, I believe it's 3 new triage beds that are going to be built at Brunswick Medical Center in the next 6 months or so, which is very exciting. So those are some of the things that we fund. And then this is kind of giving you a sense of who Novant Health is in our region. So this is what we think of as the coastal region, primarily spread along the coast. Most of our facilities are in Onslow County through Brunswick County. These are our 5 major hospitals on the side. So of course, New Hanover Regional Medical Center here in Wilmington, Brunswick Medical Center, Pender Medical Center. I don't know if any of you live up in Brevard, but there's been a lot of work done on that facility in the past couple of years, and they do a phenomenal job of caring for that community. Our orthopedic hospital on Wrightsville Avenue, and then the Scottsville Medical Center, which will open in June, and is very exciting. It is a beautiful campus. If you live up in that Pender County side of Wilmington, it's going to be a fantastic new resource for our community. So I'll talk a little bit more about that in a minute because it is so exciting. So go ahead, Brandy. But this also gives you a sense. Our hospital was purchased 5 years ago. I don't know if that's hard for you to believe. It is kind of hard to believe that it has been 5 years since Novant came into our community. And one of the big commitments that Novant made was to invest funds into this region to grow access to care for people in our community. So this gives you a sense of some of the big things that have happened since that purchase. So let me point out a few of them. Pender Medical Center was purchased. Our Neurosciences Institute was built and opened at the main hospital. Our community care cruisers came into the community and started going live. We opened 2 Michael Jordan medical clinics. If you haven't seen them, they are beautiful. One is on Greenfield Street and one is on Princess Place. Princess and 30th, I think. They have both been open. Well, the second one opened about a year ago. I don't have the updated numbers in front of me, but they're seeing a lot of patients and doing a really good job of serving those communities, providing primary care, also some behavioral health care, some OBGYN care, some pediatric care. Each one has really grown to cater to what the need is in the neighborhood that they're serving, which is important. Scotts Hill Medical Plaza, opened to grow the Scotts Hill campus. Autumn Hall Medical Office buildings opened on Eastwood, and then the Scotts Hill Medical Center will open this summer. So flip to that and we'll look at that. This is probably a year old, this picture, but it gives you a sense of that campus. So that's 17th Street up top there. This is the surgery center that's been there for a while, the medical office building that's on campus. This white roof is the freestanding emergency department that has been in Scotts Hill for a long time. So this hospital is doubling the size of the emergency department. And then if you want to flip the screen, Randy. We'll also have 78 inpatient beds, including 8 ICU beds. So this will be a full community hospital, really serving a lot of the needs of that community. You can see operating rooms, PET scanners, MRI, CT scanners, cath lab, and then these are all the specialists that will be spending time in that hospital caring for patients. So I have seen, it's been about 6 months since I've been in the building, but it is beautiful. Light-filled rooms, beautiful coastal color scheme. I think it's going to be a really neat place to receive care in just a smaller, homier environment than what we can do at the big hospital on 17th Street. So watch for that. It will be opening in June. There will be a community open house. Tentatively, I think it's set for the 2nd Saturday in June. If you live up that way and you're curious, I encourage you to come out and see the hospital. But we're really excited to bring that resource to our community and to decompress some of the need that is happening at our 16th Street campus to have another resource for people to receive care. And then hopefully you have also seen in the past couple months, Novant announced a huge investment of resources into the 17th Street campus. So there's more than $1 billion that will be invested in our main hospital in the next 5 years. So the goal of that project is really to go through a master planning process to make sure that our hospital can meet the capacity of our growing community and meet the need. And so one of the things that will happen is a reconfiguration of the first floor of the hospital to make sure that flow of traffic is better, it's a little easier to get where you need to go when you're in the hospital, and that all of the priority spaces are being used for patient care in the ways that they should be, and that patient care flow is happening as smoothly as possible. And then the other big piece of that project is a new heart and vascular tower. So this will be an 8-story, 200-bed tower, kind of wrapped around behind the Women's and Children's Hospital on the left side of the building, if you're looking at the campus. This should open by 2031, I believe is what we're saying. So it is a long-term project, but not that far away. And we know that this community is growing quickly, and that there's a lot of older people in this community who need heart and vascular care. And so we have an excellent team right now, but we don't have the capacity to meet the needs of this community. So the goal of this project is really to provide top-of-the-line care and to make sure that we have enough providers to meet those needs. So watch for that, it is coming. And now we're going to talk about the grant that you all have made, which was a $10,000 grant. to support our NICU. So Brandy, I'll talk a little bit about the Women's and Children's Hospital and then the grant.
Just pull, is it better if I hold it way down here? Is it too loud? Okay. Oh. Okay, thanks.
If you still can't understand her, stop and let her know.
Yeah. So I'm Brandy Garris, and I manage the Neonatal Intensive Care Unit. The Women's and Children's Hospital was built in 2008, and I had the privilege of helping to design that building and what the NICU looks like now. When I started as a new grad nurse in 1997, I'm giving my age away, we were in a big open bay NICU. Babies, we were kind of on top of each other. Families didn't have their own space, no privacy. And so in 2008, the Women's and Children's Hospital was built and opened, and we have a pediatric inpatient unit of 18 beds and an ICU of 7 beds. And then the NICU has 45 private rooms. And so our families can have a space where they can call it home for a while, because they're with us for a while, some of them up to 6 months, and some longer, but on average about a month. And so for last year, in the whole Women's and Children's Hospital, we had a big year of 4,905 deliveries, and the NICU actually had the highest census that we've had for the year, and it was 750, I think it might be on my next slide, 759. 739. So we cared for 739 babies, and our average daily census, which is what our normal number of patients is that we have daily, is 42. So 42 babies from age 22 weeks to term come to our unit. We have 5 neonatologists and about 10 AEP nurse practitioners, and then I have about 120 nurses that care for these babies. So you can go to the next slide. So this device, thank you so much for supporting us purchasing this device. It's called a Pacifier activated Lullaby system. And so what it does, and we're going to show you a video in a minute because it really, you'll be able to see it in action. This device, you can see that it has this blue right here. It's a piece that goes inside of a pacifier. And so it encourages the baby to, when babies are born, they can't suck, swallow, and breathe till about 34 weeks and coordinate all that. And so in the beginning, their suck is, it can be weak, it can be uncoordinated, and so they all have to eat to go home, right? And they have to be able to do that and gain weight and not use all their energy to just to eat. So this allows them, prior to starting to eat by mouth, because they will have an NG tube or an OG tube, so we feed them by tube before they can eat by mouth. This hooks up to the PACI, and it, when the baby produces a strong, effective suck, it rewards them with music or the mother's voice. And so it is, it's kind of a, sorry, I lost my train of thought. It encourages them to suck effectively. And so what they found is that with that, it reduces their length of stay because they develop that suck coordination and the effective suck sooner, and then they eat sooner, and so then they can go home sooner. So if you want to go to the next slide. This is what I just said, actually, but this is what it looks like. The devices, and we have 3 devices that you guys gave funds for, but this is exactly what it looks like. And so between our nurses and our speech therapists, they will be using these to support our babies. We just received them about a month ago, and our nurse practitioner, who is really trained and has used these in other hospitals and really seen the effectiveness of them, has had some health issues. So We're hoping in the next 2 months that we'll be able to move forward and get those in action using them. So we'll have to share that once we do that. But if you want to go to the next, we have a video for you guys to watch of the system in action, and it tells a bit about it. But I don't hear anything. Yeah. Oh, shoot, I wanted you to be able to hear the whole thing. Oh, I'm so sorry. It's on, like this, like no sounds coming. What if we do the sound out of the computer?
A severe form of preeclampsia called HELP syndrome. And so to save my life, they had to deliver the twins via C-section a little early. Now we've gotten over a bunch of milestones, but the last thing they're having some trouble with is eating.
Babies that are less than 34 weeks.
I developed a severe form of preeclampsia called HELP syndrome, and so to save my life, they had to deliver the twins via C-section a little early. Now we've gotten over a bunch of milestones, but the last thing they're having some trouble with is eating.
Babies that are less than 34 weeks gestation, they don't know how to suck from a bottle yet, so sucking on a pacifier helps them with their comfort, helps them be less stressed. And then what we've seen is the babies that use the pacifier-assisted lullabies, they're ready to eat sooner, they go home from the hospital sooner, they tolerate their feedings better.
When they came to us and said, can we use, this device on your shoulder and it rewards with music, I didn't even think about what it did. I just said, oh, music, sure, yeah, that's wonderful. And then when they came in and explained it to me, I said, oh, wow, that's really, unique.
They love the music part. It's soothing to them. When they suck, the music comes on. When they stop sucking, the music goes off. So they quickly make that connection between the soothing music and the sucking.
When babies are in the NICU for care, they sometimes stay 3 months before they can go home from the hospital. That's an awfully long time for parents to be separated from their child. So the PAL offers a way for parents to get involved immediately, especially in a critical behavior like learning to feed, because that's key to going home from the hospital, leads to discharge almost immediately.
I'm thankful for it, that it has helped strengthen those muscles and teach them how to eat.
So that is basically how it works, and like I said, we haven't started using it in our hospital yet, but we plan to do that in the next 2 months to get that going. But what questions do you guys have? Does anybody have any questions? Yes?
So that music that was just playing when you were showing the video, is that the actual music the baby listens to?
No.
That was pretty annoying.
No. Yeah, no, sorry. It would be like very peaceful lullaby music, or it could be the mom singing. You can do that, or the mom talking. You can program it to do different things. Oh, that's perfect. What other questions? Does anybody have any other questions about the NICU or the device or anything?
So you said you had 3 of those and each now going 3 babies and
Yeah.
then you trade off.
Yeah, so yes, we would just use them at different times. The babies are on different feeding schedules, and so depending on, and some babies, like if they're they wouldn't be using these until they're about 32 weeks. So all of our babies that are born prior to that, they wouldn't be using this. So there's just a specific period of time in their journey with us that they would use this device as they grow and learn how to eat and develop that stuff.
So when you feel it would be worthwhile to a particular baby to try this machine out. So you put them on that machine every feeding for a couple of days, or how do you schedule it?
No, I believe that we would do it, it's not every feeding, no. I think it would be a couple times a day, and as they develop. Our PT and OT would help, or speech, would be the ones who kind of helped us drive that to see how the baby was doing, and then as they get to age, then we would see how they were doing with the bottle. And so I would suspect that it would be probably once or twice a shift that they would be using this.
Would it be
They can, yes. We can pre-record or have specific music. So in that case, we would have to have it, for that individual baby for a period of time, because we wouldn't want to be playing this mom's voice on a different baby. So we'd have to work through that. And that's part of our work that we need to do, is figuring out exactly what our standard process is going to be to use it in our unit. And so I'm waiting for our clinical expert to get back from her health issue to be able to help us do that. Yeah. Any other questions? Oh, you talk about that.
So, yes.
Hello.
So the way that we learned about the grants, we have that supporting all 7 Novant foundations. We have a grants team that has some grant writers on it, and they do a lot of that research regularly. I'm not sure if they've applied for Philoptochos Society grants in the past or not. My understanding is you rotate the priorities of the grant each year. So Novant as a whole actually received 2 grants this year. Our hospital in Charlotte also received a grant for their NICU. I heard at one point what that was for, but I don't remember at the moment. And then we were privileged to receive one here in Wilmington. But yes, their whole job is to research and write those grants. And then they pulled Brandy and I in once they were planning to write one for the NICU here in Wilmington.
When's your baby shower?
The baby shower, so yes.
We're excited about this.
Well, I guess I'll just talk about it. Brandy can see if she can. So Novant Health has done a baby shower in Brunswick County for about 10 years. And we are very excited to be bringing that baby shower to Wilmington this year. So there will be one in Brunswick County the first Saturday in May, and the items that you all have been collecting will be for the baby shower here in Wilmington, which will be Saturday, May 16th. So this is a resource for new and expecting families who can come. We'll be at a new medical office building that is in the old Verizon call center that is kind of across the street from Live Oak Bank, off the corner of Shipyard and Independence, tucked back in there. We are expecting 500 families to attend the shower in Wilmington and 200 to attend the shower in Brunswick County. So every family who comes everyone is welcome. Everyone is invited. They will be screened for social determinants of health. That day we'll have food boxes that we can provide to families who need them. We'll also have community care workers who can follow up with people if they need extra care afterwards. But that day, they will receive one large item, their choice of a car seat, pack and play, or stroller, and then they'll receive a whole package of smaller items. So the things that you all have collected will be part of that package of resources that those families receive that day at the baby shower. And then there will be probably about 15 different nonprofit organizations and healthcare resources that are there. Our lactation teams will be there. Our pediatric care teams will be there. We have some pediatric dentists coming. We'll have the YMCA and Smart Start and Nourish and See, and a lot of different resources here in the community that we'll be connecting families to make sure that they have what they need to raise healthy babies. And we know, we hear in the NICU from families, we hear in other parts of our hospital, that not everyone gets to have a baby shower. So we're gonna have a DJ there. In addition to just being a resource fair, this will also really be a celebration for these families. We are excited about the babies that we are having, and we want to share that excitement with them. So you were helping to provide resources for the shower, and we're accepting volunteers as well. So if anyone is interested in volunteering with the baby shower, let me know. Courtney can definitely connect us, if not today. But we're so grateful that you are helping out, and this is something that will happen every year. So if your group would like to support the baby shower going forward, it will probably be the third Saturday of May every year. Okay, well, sorry. So you cannot be there to volunteer.
Bring them to the festival.
And after those families come with us in the morning, maybe they'll come over to you. But we're really excited. It should be a great new resource for families in our community.
So how are you getting the word out to the families who will be your guests at the shower?
So if you were paying attention earlier, there were almost 5,000 babies born at our hospital last year. So we are spreading the word, but we're attempting to do it in some pretty strategic ways. We're not just shouting out on the radio, everyone come get a free car seat, because then we're afraid we'd have 5,000 people show up. And like I said, we're preparing for 500. We know we'll have a lot of people, but we're really strategically communicating through some of our Medicaid OBGYN clinics that the hospital has, through our care teams at the hospital, really asking them to help identify families who need extra support and making sure that they know about the shower and can be there. So we're doing that a lot through our healthcare partners and resources to help spread that word. Yes. 9 to 11. So you can do both. Any other questions?
Can I ask
Yes.
a quick question about your first presentation?
Yeah.
So where exactly is that heart and vascular tower going to be? And then that mobile mammogram
Yeah.
truck or bus, where does it go and when? And how do the people you're going to find out about it and avail themselves of the services?
Yes. Okay, so the tower first. So if you are familiar with our main 17th Street Hospital campus, tucked behind the Women's and Children's Hospital right now is our rehab hospital and our behavioral health clinic. The rehab hospital is actually going to be relocated to our orthopedic hospital campus on Wrightsville Avenue. We're building a new 60-bed rehab hospital behind the existing orthopedic hospital on Wrightsville Avenue. So they'll be connected by a walkway, but it will be its own separate building. So that hospital's being relocated first, and then once they move, the rehab hospital will be torn down. And that footprint at the main hospital campus is where the new heart and vascular tower will be built. So it'll be around that left side of the hospital building. And then the mammography bus. So it is scheduled in a lot of different ways. They do visit different health festivals and events around town. They also can be scheduled by anyone who would like the mammography bus. So for example, if you all wanted to pick a day and have it come to the church, and be able to sign up to receive your mammograms there, you could do that. So it does both free care and also insurance care. So when it is scheduled to be in a location around town, whoever's hosting the bus gets the communication out about how people schedule their mammograms to have on that site. And then, like I said, if it was me and I was using my insurance, the bus would bill my insurance. If it was someone who didn't have care, then the resource fund would help to cover that. So it is part of providing access to care and free resources, but that fund also operates outside of the bus, and the bus also operates by insurance. So I hope that is helpful and makes sense.
So like, let's say you're going to a church and the church is organizing that people should come that day and have a mammogram. So is it all free or everyone has to pay? Or if you have insurance, you show your cards, or if you don't, you pay. Correct. Then?
Yeah, so if
it's
you
not
have
free to the customer.
Not necessarily, no. If you have insurance, the staff on the bus would collect your insurance information and bill your insurance. And if you don't, then they would help you access the funds that are available for care. Yes? Yes, it is the same one that's at the Run for the Tatas. Yes. Yeah. Any other questions? So, to reiterate, that mammography bus is the same one that's at the Run for the Tatas. That was a question we just answered. It is a great resource. And it's a 3D mammogram. So it's top-of-the-line technology with the goal that someone does not have to come back or see a provider for additional testing after that mammogram. So anything else? So we are so grateful. Thank you for your support. Thank you to the larger Philoptochos Society. And yeah. We're grateful.
Thank you for taking the time on your Sunday. We got you some lilies and some cards and our things in those cosmos. Dana. Those are the saints of Philoptochos. So we just want to say thank you. And we did have some people, I know some people questioned about giving money. Like if there was a site that they could go to, you could just email me and I could share that
Absolutely.
for donations.
Yes, and I can give you the general donation site and the baby shower donation, specific donation site, because both are available.
Thank you so much.
Thank you all for sharing today. Oh, geez.
Okay.
Courtney, I'm going to set this here.
Thank you, Linda.